You know that strange ache in your chest? The one that comes and goes? You tell yourself it's just gas. Maybe something you ate or stress from a long week. You ignore it, take a deep breath, and move on. But what if it's not that simple? What if that small discomfort is actually your heart sending you a warning? Welcome to Dr. Danzy Senior Health Tips. I'm Dr. Danzy, and today I'm going to help you understand one of the most dangerous signals your body can give and how to recognize it before it's too late. Because that strange chest feeling could be angina, and angina is often the first warning sign that your arteries are getting blocked. Stay with me, because what you learn today could protect your life. First, let's understand this clearly. Your heart needs a constant supply of oxygen-rich blood. This blood travels through vessels called coronary arteries, but over time, due to high cholesterol, high blood pressure, or poor lifestyle, these arteries can start narrowing. A sticky substance called plaque builds up inside them. This process is called artery blockage. Now, when your heart doesn't get enough oxygen, it sends a signal. That signal is called angina. But angina doesn't always feel like sharp pain. Most people describe it as pressure in the chest, tightness or squeezing, a heavy feeling, or discomfort in the center of the chest. Sometimes it spreads to arms, especially left, neck or jaw, back, even the stomach. You may also feel shortness of breath, sweating, dizziness, nausea. And this is why many people confuse it with gas or acidity. But here's the key. The pattern matters more than the pain. Now listen carefully, because this part is very important. There are two types of angina. 1. Stable angina. This is the warning stage. It usually happens during activity, like walking fast, climbing stairs, or stress. Your heart needs more oxygen, but blocked arteries can't supply enough. So you feel discomfort, but here's the sign. It goes away when you rest, it follows a pattern, it lasts a few minutes. This is not a heart attack, but it is a serious warning. Your body is telling you, something is wrong, fix it now. 2. Unstable angina. This is dangerous. This can happen anytime, even when you are resting or sleeping. The pain is stronger, lasts longer, 15 to 20 minutes or more. Does not go away with rest. This happens when a blockage suddenly becomes severe, and this is often just one step before a heart attack. Think of it like this. Stable angina, dash a warning light. Unstable angina, dash emergency alarm. Now here's the most important part of this video. When should you act immediately? If you feel chest pressure or heaviness that is severe, pain even while resting, pain lasting more than 15 minutes, shortness of breath, sweating, nausea, or dizziness, pain spreading to arms, jaw, or back. Do not wait. Do not ignore it. Call emergency services immediately. It is always better to be safe than to be too late. But if your symptoms are predictable, coming during activity and going away with rest, then don't panic, but also don't ignore it. Book a doctor appointment as soon as possible, because this is your chance to stop a future heart attack before it happens. Now let's talk about what you can do, because the good news is you can protect your arteries. Start with your food. Eat more. Fruits like berries, green vegetables like spinach and broccoli, oats and whole grains, beans and lentils, nuts like walnuts and flax seeds, fatty fish like salmon. These help reduce inflammation and keep arteries clean. Avoid or limit processed food, too much sugar, fried food, excess salt, refined carbs like white bread. Now your lifestyle. Walk at least 30 minutes daily. Manage stress with breathing or relaxation. Sleep 7 to 8 hours. Drink enough water. These simple habits make a huge difference. Let me ask you something. Have you ever ignored a strange chest feeling, thinking it's nothing? Because that's exactly what most people do. Until one day, it's no longer small. So here's your action today. If you have severe symptoms, act immediately. If you notice patterns, get checked this week. Don't wait for things to get worse. If this video helped you understand your body better, subscribe to Dr. Danzy Senior Health Tips, because here, we don't just give advice, we help you avoid the mistakes that cost people their health. And before you go, tell me in the comments, have you ever felt this kind of chest discomfort? Take care of your heart, because it works for you every second, even when you don't notice it. I'm Dr. Danzy, and I'll see you in the next video.